Hi everybody, Dr. Sabrina Brown back for part 2 or lecture 2 of the 3 for your class on injury and violence. So the CDC has put together a course for this intersection of public health working with law enforcement and the collaboration between the two agencies or entities, whether it be local, state, or national. So they have this course that they develop, and they have case studies, and it's pretty involved, but it's really an excellent course from what I can tell in reading the materials. So I wanted to talk to you about one case study that I found really interesting, and it is a real case, so you can look this up on the web and find out more about it if you're interested. I'm just going to give you the skeleton of what happened and why it was so important for the CDC and the FBI to work together ultimately. So in September of 1984, a disease control expert, probably an epidemiologist from a local public health department, received cases of basically stomach flu in persons who had eaten meals in one of 2 restaurants in the area where the local health department served. And then they had several days before the onset of the symptoms. So the local health department has frontline responsibility for conducting public health surveillance, and it's their responsibility for receiving and collecting information about reports of cases of specified diseases. And then as they need more help, they ask for help from the state health department, which happened a short time later in this case. So they collected stool samples and had them cultured, and by the end of the week they determined that they had 15 people reporting the same case positive for the bacterium Salmonella. And 1 week later, that same expert learned that there were additional cases of illness in the community and that some affected people had actually been hospitalized because of these illnesses. So as a result, that person did contact the state health department, and they became involved 1 day after that round of illnesses where people had been hospitalized. And then the state ended up contacting the CDC for assistance. And so they were looking for a link between those people that were eating in the restaurant having eaten at salad bars and becoming ill. So the salad bars were closed, but not the entire restaurants. And this is the job of the epidemiologist, to find the source of what is causing this illness or this outbreak. So a health department might begin a full formal investigation in a case like this when there is evidence of an outbreak like this. And that means that the number of cases exceeds what would be expected for a given place or a time period. And they're identifying the mode of transmission, what is the route of exposure, how contagious it is, and they're trying to determine what the disease-causing agent is, which they found in this case. And then they can use what they found to, lessons learned. How can we improve how we approach these cases? How can we stop outbreaks of situations like this in the future and future reoccurrences? At first, they would look at typical causes: improperly handled or stored food, or a breakdown in the food manufacturing process. So that's where they would likely start. So by September 26th, 2 medical epidemiologists from CDC arrived in the area to provide assistance with the investigation, including helping to identify additional cases. They also helped collecting patient specimens, analyzing the data, and assessing the basis for and impact of intervention of closing the salad bars. So over the next 6 weeks, a public health team, which included local state health departments and people from the CDC, continued an extensive investigation, collecting additional data and samples, and determining, ultimately, they identified a total of 751 people with these cases, and it was a fairly small community. A short time later, residents of that area contacted public health officials to express concern about the possible suspicious behavior of some restaurant employees and of some religious commune members in relation to salad bars. So they were just around the salad bars a little too much, a little too often, and local individuals started to pick up on this suspicious behavior. Some examples of when a suspicion of an intentional event might have happened are the cases are of a common disease but are out of season or are in unusual geographic areas, or the epidemiology points to a very unusual or novel mode of the spread, or the disease is unusually contagious. The cases are a disease thought to be caused by a likely agent but cannot be readily explained. Another reason is investigators can't solve or explain the outbreak by the usual techniques that they use. So those are indicators that it might be an intentional situation. So how about law enforcement? So some of these are kind of emerging. So what happens next? How do we involve our law enforcement? Early notification to the FBI by state and local public health and or the CDC can notify the FBI when the circumstances of the incidence of disease are unusual or may not be consistent with natural occurrences. In this situation, it is a food contamination. So the use or threatened use of a biological agent against humans, animals, or plants is a federal crime under the Weapons of Mass Destruction statute, and it may constitute a bioterrorism attack against a multiple jurisdiction situation. So in that case, the federal agency would need to be called immediately. However, the FBI, they might investigate and ask local law enforcement to help with their investigation. But when they become involved, they establish a joint terrorism task force because it could be a terrorist event. So the FBI office, who initiate additional notifications, they reach out to the Interagency Threat Assessment process through the FBI's Weapons of Mass Destruction Operations Unit, and what that is, it just brings the situation into a protocol, into a structure that's been established, and then they can abide by what has been predetermined to be as effective as possible at that point in time, and then they have prepared for a situation like this and developed the outline, the protocol. And this initial criminal investigation works to complement the public health investigation that's already started. 1 year later, as part of a wiretapping and immigration fraud investigation of the religious commune that the local individuals had seen suspiciously around the salad bar often, so they actually continued investigation into that group. The FBI and other law enforcement officials received key information from informants who were also members of that religious commune. And they stated that beginning in August of 1984, members of the commune had intentionally contaminated salad bars with salmonella for the purpose of influencing a local election to be held in November of 1984. So in October of 1985, FBI and other law enforcement officials visited the commune's compound, and during that visit, they did find a vial of dried salmonella, and they did determine it was identical to the outbreak strain that they were finding in all of the patients consistently. And so they discovered through the state health department's laboratory that that vial did match members that were diagnosed as positive to that salmonella strain. So indictments were handed down, and 2 commune members, a nurse, and the secretary to its leader were convicted and sentenced. So I just leave you with that. I just wanted to give you an example of how interesting it is, this whole field of study. It's very interesting. That's just one example about forensic epidemiology. Winston, you don't have to put any of